The federal government has emphasized that malaria and neglected tropical diseases continue to pose significant threat to public health in Nigeria, with malaria remaining a leading cause of illness and death. According to Dr. Chukwuma Anyeke, Director of Health at the Federal Ministry of Health, over 200,000 deaths occur annually, mostly among children. Represented by Fatai, a national coordinator for NTDS, Dr. Anyake spoke at the commemoration of World Mosquito Day and the launch of the Nigeria Malaria and NTDS Youth Corps in Abuja. He highlighted that NTDS, like an oncocerciasis and lymphatic filariasis, affect vulnerable communities, perpetuating a cycle of disease and poverty, and the impact of these diseases extends beyond healthcare, affecting families, communities, and the broader economy. However, Dr. Anyake emphasized that the event was not just about acknowledging challenges, but taking action and empowering youth to lead the fight against malaria and NTDS.
Malaria and NTDs continue to pose significant threats to public health in Nigeria. And malaria remains a leading cause of illness and death in our country, affecting millions of lives each year, with over 200,000 deaths being recorded annually. This affects mostly the youth, the children, and the impact of malaria on our families and community cannot be overemphasized.
The Executive Secretary of Nigeria and Malaria Council, Okpe Agboden, emphasized that malaria continues to disrupt lives in Nigeria, noting that the continent remains committed to eliminating the disease.
While we celebrate this launch, we must also acknowledge the ongoing challenges in the fight against malaria. Africa is at the center of a perfect storm that threatens to disrupt essential life-saving malaria services and undo decades of progress. Financial constraints, biological threats such as drug and insecticide resistance, and the intensified impacts of climate change continue to threaten the gains we have made.
The youth of Africa are not just leaders of tomorrow, they are the leaders of today. They have the power to influence their communities, mobilize action, and advocate for the necessary resources and policies to eliminate malaria and NTDs. By engaging young people in this fight, we are not only investing in the future, but are also ensuring that the efforts to eradicate malaria and NTDs are sustained and amplified across generations.
With youth accounting for over 70% of the population, maximizing the youth will bring a lot of positive change, especially in our community and in the country, in the fight against neglected tropical diseases and malaria. This also channels the strength of the youth into the global focus of Sustainable Development Goal and the World Health Organization Roadmap 2030. Our mission is very simple. Our mission as a volunteer youth corps is to see a Nigeria where every youth is powered to champion universal health coverage and combat malaria and neglected tropical diseases.
The disease is responsible for approximately 60% of outpatient visits, 30% of hospital admissions, and nearly 200,000 deaths annually. Economically, malaria has inflicted substantial losses, impeding productivity and placing heavy burden on Nigerian healthcare system. In addition to malaria, NDT remains a severe problem in Nigeria, which accounts for around 25% of Africa's NTD cases. According to the WHO, 165 million people in Nigeria, approximately 84% of the population, require preventive chemotherapy for at least one NTD.